So now let's apply some of these principles we've learned to a case. So in this situation, we have a 4-year-old with asthma. So our patient is a 4-year-old male, known asthmatic, with no other medical conditions. He's admitted to the floor for status asthmaticus. In the emergency center, he had an initial clinical respiratory score, or CRS, of 7, and received back-to-back albuterol treatments for 6 hours, intravenous magnesium sulfate once, and IV steroids. You meet the family, and you learn that the patient has had a cough, nasal congestion, and runny nose for 3 days, but no fever. The mother shows you his old medications, which have been empty for the past 4 weeks. Flovent, 44 micrograms, and Xopenex, as well as a spacer device. Intermittently, he's had some shortness of breath with play and has had to stop to catch his breath. He has daytime asthma symptoms approximately 3 times per week and uses Xopenex almost every day. He also has nocturnal awakenings 4 times per month due to a cough. He has a history of 1 admission to the intensive care unit 3 months ago for status asthmaticus and no history of intubations. He goes to the emergency room about 2 to 3 times per year. He's prescribed oral steroids for asthma exacerbations a few times a year, and this helps significantly. He missed his first appointment to see a pulmonologist because the family didn't have enough money for gas that day, and they didn't call ahead to arrange Medicaid transportation. This is the patient's 3rd hospital admission for an asthma exacerbation in the past 12 months. He also has a strong family history of asthma and eczema, but otherwise his past medical history, social history, and review of systems are non-contributory. On physical exam, his vital signs are significant for a temperature of 37, blood pressures 90/60, heart rate 130, respiratory rate 32. His satting 93% on 1 liter per minute of oxygen by nasal cannula. He has normal growth parameters. In general, he's alert but tired appearing. He has boggy nasal mucosa with clear discharge, normal tympanic membranes, no cervical lymphadenopathy. His neck is supple. On respiratory exam, you note fair breath sounds with end expiratory wheezes most prominent at the bilateral bases. No crackles are heard, and he has mild suprasternal and intercostal retractions. He has regular rate and rhythm without murmur, and he has good pulses. His abdomen is soft, non-distended, he has good bowel sounds, and no organomegaly. No clubbing or cyanosis is seen, and he has normal muscle tone throughout. He does have scattered eczematous patches on his arms and legs. So you are taking care of admission orders. In addition to bronchodilators, per respiratory assessment and management protocol, or RAMP, and steroids, which of the following do you decide to order? A, chest radiograph. B, potassium level. C, complete blood count. D, chest radiograph and potassium level. E, nothing.